Good afternoon, everyone. We are getting ready to start our English Congresso. It's a meeting where we want to hear feedback from our community, the ones that are our patients that attend to LCH. So stay tuned. We're going to be starting in about a couple minutes, just waiting for a couple of participants to join us. We're just going to start soon. Thanks. Hello, everyone. Thank you for joining us again. We are about to start our second meeting of Congresso, we call it, where we invite some of our patients or some of our community members that are in our Facebook page to join us and give us some feedback on things that we're doing good, things that we could improve at LCH. So stay tuned. We are about to start. We're just giving a couple more minutes to more participants to join. So we'll be starting shortly. Okay, welcome everyone. Today we are gonna be hosting our English Congresso. Yesterday, Wednesday, we had our Spanish Congresso where we listened to some questions, and today we wanna hear our English-speaking community as well. We try to serve everybody, and that's our hope, that we can serve you the best way we can. And this is the reason why we are doing these meetings called Congresso, is for you to share your feedback with us. Just wanted to, before we get started, I wanted to point a couple of things. And one is that we're on Facebook Live. So if you are listening to us or watching us on Facebook Live, feel free to comment as we touch different topics. There's one of our coworkers checking out Facebook, so that person's gonna be sending the questions to our Zoom chat, and we can discuss. Either it's a question, if that's an opinion that you have, some feedback, please share it with us. We want to hear you. We want to improve our services, and we want to serve you the best way we can. So a couple of things for whoever joining us on Zoom. Feel free to ask questions as well. And you can use the chat option where you can post your questions. Everybody will see them. There's also a Q&A option So feel free to ask any questions, share opinions as well. We're going to be talking today about wellness during the pandemic, during COVID-19. So how has LCH helped you to stay healthy? Have we even helped you to stay healthy? Are there things that we could improve or add to our services that will help you stay healthy? So we will be touching different topics regarding of wellness. However, feel free to ask any other or share any other opinion or ask another question. We have some of our staff here with us, joining us as a panelist, and I want to start by introducing them. The first one is Colleen. She's one of our pediatrics nurses. So she's going to be joining us today, giving some input on pediatrics as well as general medical questions. We also have Meredith, which is part of our behavioral team. She's one of our behavioral health consultants. And we also have Margarita, which is head of HR and HR manager and also our interim CEO. So Margarita is going to be with us as well, sharing some information about LCH. And with that, I'm going to give some time to Margarita to give us a welcome to everybody who is watching us. And yeah, so time's for Margarita.
Thank you, Nesta. Thank you, everyone. So good afternoon to all of you. Welcome to our Members Congress. It is an honor for me to be here with all of you and share the great work that our LCH team is doing during these difficult times that the whole world is facing. Our goal is to keep our community healthy during this pandemic. And if there are ways that we can help, we want to hear. So it is very important for us to hear from you about your experience at LCH during this pandemic. How do you feel when you come to your appointments? How you are practicing your self-care at home, and how we can help with all of them. So please feel free to share your ideas, your thoughts, ask us questions, and thank you for joining us.
Perfect. Thank you so much, Margarita. We are going to start this meeting with the topic of ongoing care. So we have a couple of questions for whoever is watching us, either on Facebook or the ones that are here with Zoom. Feel free to answer these questions and elaborate on those so we can have a better understanding on the areas that we can improve or areas that you think we've been doing great. So again, we're open to opinions as well, things that we've been doing good. It's up to you. So the first question that I have for us is, have you been at LCH for care since the start of the pandemic? And if you have, did you feel safe? So I'm going to leave a couple seconds for us to think about it. And if someone has an opinion, go ahead and share it. And if you did feel safe, please, we'll appreciate to hear your input on what made you feel safe, or if you didn't, what didn't make you feel safe. So we're going to leave a couple seconds on that question. While we think about this question, let me remind you as well, for those who are on Facebook, if you have questions after this meeting, after the Congreso, we always end up saying like, oh my gosh, I should have asked this question. So feel free to post it in the comments. We are gonna have someone continue to follow the thread on the comments and be answering the questions or sharing your opinion as the couple of days after this. So if after the Congreso you still have a question, feel free to post it, and we will follow up with you as well. But if something's coming to mind right now, that's why we're here, to hear your feedback. This is your chance that you can share your opinions, that you can, if you have any ideas that, like, it's not just up to us to come up with ideas. We always want to hear your ideas as well. Then maybe that's a very great idea that we can implement, and none of us has thought about it, and we very much appreciate that. So moving on, I'm gonna also ask the question on along the same lines of, are you comfortable coming to LCH? And if so, why? Those are some questions that we are trying to to understand how we're doing on those questions, so we can better serve our community. So again, I'm going to leave a couple of seconds to see if there are any opinions on those first two questions. Again, it's, have you been to LCH for care since the start of the pandemic? And if you have, did you feel safe? And the other one is, are you comfortable coming to LCH? And if not, why? Which I believe they are both along the same lines. So again, a couple more seconds and see if anybody is willing to or feeling the motivation to share with us. Also, while we wait, on our yesterday's Congreso, we had one of our participants mentioning that she felt really safe when noticing that we were taking temperatures at the front door. Before you walk into the office, there's always someone that is going to come and check your temperature. So that was something that made her feel safe when she was coming to the appointments as well. And yeah, I wanted to let you know that now, before you enter the building, there's like a doorbell. You touch on the doorbell, someone comes to you, checks your temperature, and then lets you in. So there are different tactics that we're taking to keep you safe. Well, in the meantime, I will have a couple of questions for the panelists, so we can keep informing the community. I have the first one will be, what are they doing to keep them safe? What are we doing to keep the appointments safe and to keep those going? Maybe the question will be, let me rephrase it better. What are we doing to keep people safe at appointments? If someone may.
I think that we can start when they are coming to LCH. No, one of the first steps is when they are coming to LCH, they have to ring, the bell just to make sure that they are there. So our staff is going to come out, check the temperature, do the screen questions, and after that is when they are coming to inside. If they don't have symptoms, so they will come into our clinic, and then our member relations specialists are going to continue with the next step. And if they have symptoms or the screening show that they have symptoms, so they are going to go directly to our trailer that is outside of our building, to provide the care that they need. But if in the case that no, then continue with our clinical team.
I'd like to add a few things so as a nurse, one of the things that we do when people call in, patients will call with a variety of symptoms that they've been feeling. And so before they even arrive to the clinic, a lot of times the nurses will take those calls and direct patients directly to the trailer, or if they're feeling unwell, but it's not necessary for them to come in, then there's also advice given for how to care for themselves at home, and try to stay better and try to get better from home so that they don't even have to come in, put themselves at risk or put others at risk. And then also in the clinic, we clean the rooms, we disinfect between every single appointment with Clorox or with disinfecting wipes. And everything is cleaned down, all of the equipment between every patient, and the nurses, the MA, medical assistant staff, and the physicians are all very conscientious about washing their hands between every patient contact. So we keep the environment that the patients are in very clean as well.
Thank you. Maybe another question for the panelists while we wait for some people to keep commenting. What about the trailer outside? Are we still using that trailer? And what is it? What's the use for it?
So the trailer is essentially a place for anybody that has symptoms of COVID. They may not necessarily have COVID, but they can go to the trailer, and it's an area that it's separate from the clinic, so that it can be disinfected, and nobody without symptoms. So let's say somebody who's coming to the clinic with a chronic disease such as diabetes or hypertension, they're coming in to just get a regular checkup, and they don't want to have to come into contact with anybody who might have a cough, who might have a sore throat. And so the trailer's there for people who have those symptoms. Again, the same measures are taken to disinfect between every appointment. But then that's where if they do want a test for COVID done, they can get that test done there. And then we also provide, if depending on the results of the test, we provide letters so that people can take off time from work if necessary, and letters to go back to work. So the trailer serves a variety of purposes, but it's mainly to keep anybody with symptoms separate from those who are just coming in for other types of visits, or for something that's completely unrelated to like a cough or a fever.
Perfect. Thank you.
Mhm.
At the very beginning, I forgot to mention one key detail, and is that at the end of the meeting, we're going to be having a raffle for 4 Longwood tickets to all of you who are sharing your opinion and commenting, participating on the questions. So even the ones who are in Facebook, as soon as you participate and comment, we're taking your name and you're putting on the raffle. And towards the end, we're gonna raffle the 4 Longwood tickets, Longwood Garden tickets. So as an incentive, not that we're gonna continue to move on the next topic. This one is about nutrition and LCH support. What are the things? How are we helping you stay healthy with nutrition, and what are the things that we could add to our services? So here's a question for you, to all of you, to start as well participating, the ones who haven't yet, and is that do you feel that you know what you need in terms of nutrition to manage any health issue? Do you feel you know what you need in terms of nutrition to manage any health issues? Like this could include, like, do I feel comfortable cooking this or not? And if you do, would you like sharing a couple things that you are doing to manage those health issues? What are you cooking? What are the things that you have learned that have helped you manage it? And if not, what is something that we can do as LCH to help you maintain, to help you manage, to better manage that nutrition? So so we're gonna leave a couple seconds there, see if we have any participation as well. Remember, Facebook participants, feel free to comment as well. We also have that second question, that is, do you have access to food that you and your family need? And that's a question, like, also, let me put it out there. If you know of, like, do you have access to food that you and your family need? And if you do, that's great. If you don't, we will also like to know which community resources for obtaining food do you know? Do you know any resources in the community where you can obtain food? In the meeting yesterday as well, one of our participants mentioned about, like, we at LCH partner with the Chester County Food Bank, and we provide sessions for cooking classes that are called Eat Fresh. That one of our participants mentioned that she felt really benefited by it because it's like a weekly class that they get. They get to cook, learn how to follow a recipe on cooking healthier with vegetables, and every other week they were getting a box of produce for free by participating in this program. So just so you all are aware, we constantly keep on starting these sessions. It all depends on the Chester County Food Bank. They are the ones that lead it. But that's something to keep in mind if you are looking for a place to learn and get started on using new vegetables, learning how to cook them. Join that class. Stay tuned to our Facebook page. We are constantly posting updates in our Facebook page as well as our website. So keep checking, and you will know when the next registration time is, when we have those available times. But again, we're here to hear you. Remember, if you participate, you can win the Longwood Garden tickets as well. We want to hear how we're doing to help you with nutrition. That's the main topic we're touching right now. And if there's anything that we can do, a service that we could add, something that you've been thinking that would like us to add, or something that we've done, great. We're here to hear you.
I don't know if there's anybody out there listening who's participated in the family fitness program. That's something that we had in pediatrics. We'd love to get feedback to see if that was helpful at all, to see how you liked it, and get feedback to see if there's anything you thought that we could do differently. So we welcome any answers about that as well.
Thank you. And remember, keep posting on Facebook. If you cannot think of the question right now, leave the comment, and one of us is gonna reach back to you with the answer as soon as possible. While we give some time for a little bit more of participation, we have a video that we wanted to show about exercise. Maybe that will help us understand a little, if you're just paying attention, see what other options you can do during this pandemic. So I think we're gonna show that video for a little bit. In the meantime, let me remind you of the questions. You feel free to keep to comment on the questions as we're sharing this video. We have the questions that I recently asked is, do you feel you know what you need in terms of nutrition to manage any health issues? There's also do you have access to food that you and your family needs? And if you don't, or even if you do, which community resources for obtaining food do you know? Are there any community resources that you could that you do know when you need to get some food? Or if you know that someone needs something, do you know where to send them as well? So we want to hear your feedback, and we'll see if we can get this video going in the meantime.
Exercise is important for your physical, mental, and emotional health. Now more than ever, it is time to start making healthy changes for you and your family. El ejercicio es importante para su salud física, mental y emocional. Ahora más que nunca, es hora de comenzar a hacer cambios saludables para usted y su familia. Here are 5 tips and ideas to make staying active a bigger part of your daily life. Aquí hay 5 consejos y ideas para hacer que mantenerse activo sea una parte más importante de su vida diaria. Number 1, make a calendar. Plan out your fun activities for the week together. Post it somewhere in your home where you can see it, and make sure to add a check mark or a sticker after you complete the activity. Celebrate as a family. Número 1. Hacer un calendario. Planificar sus actividades divertidas para la semana juntos. Publicar el calendario donde puedes verlo. Y asegúrate donde agregar una marca o un sticker después de completar la actividad. Es importante celebrar juntos con su familia. Number 2, find the right time. Everyone has different schedules. What works for someone else may not work for you, and there's no right or wrong time. Whether it is an activity first thing in the morning, after work, or after dinner, find the time that works best. Número 2. Encuentra un momento adecuado. Todos tienen horarios diferentes. Lo que funciona para otra persona puede no funcionar para tu familia. No hay momento correcto o incorrecto. ya sea que se trate de una actividad a primera hora de la mañana, después del trabajo o después de cenar. Encuentra lo mejor para ti. Number 3, preparing the day before. Planning ahead will make it easier to find time for exercise. Número 3, preparando en el día anterior. A planificar con anticipación hará que sea más fácil encontrar el tiempo para hacer ejercicio. Think about planning out your activities just as you would plan ahead for a meal or for setting out your clothes the night before. Going for a walk tomorrow? Is the stroller easy to get to? Do you know where the sunscreen is? Piense en planificar su actividad tal como lo que haría con anticipación para preparar la cena o para arreglar su ropa la noche anterior. ¿Salir a caminar mañana? ¿Es fácil llegar al cochecito? ¿Sabes dónde está el protector solar? Number 4, set a timer. It is easy to get distracted. Set a timer and dedicate that time to movement. Don't stop until the timer is up. Número 4. Establecer un temporizador. Es fácil distraerse. Establecer un temporizador y dedicar ese tiempo al movimiento. No te detengas hasta que se acabe el tiempo. Be patient as you all learn how to make time for exercise. Start with 10 minutes, then you can move up from there. Tenga paciencia mientras todos aprenden a hacer tiempo para hacer ejercicio. Comience con 10 minutos de actividad y luego puede avanzar. Number 5, try different things. Número 5, probar cosas diferentes. There are so many different ways to be active. Do some research and try out things that look fun. If you find one that you love, write it down or save the link on your phone. Ask friends and families what they are doing and share ideas. Keep a list of activities that you and your family has tried and likes to do. Hay muchas maneras diferentes de estar activo. Investiga un poco y prueba cosas que parecen divertidas. Escribe los que le gusta en su móvil en una lista. Pregúntales a sus amigos y familiares que están haciendo ejercicios diferentes y comparten ideas. Mantenga una lista de actividades que a su familia le gusta hacer. Here are 5 ideas on how to stay active with your family. Aquí están 5 ideas a mantenerse activos con su familia. Number 1, outdoor games. You can be a kid too. Try any of these games that will be sure to get your heart rate up and fill your belly with laughter. You will be surprised how much fun you can have. Things like hide and seek, red light, green light, and Simon Says. Número 1, juegos al aire libre. También puede ser un niño. Pruebe cualquiera de estos juegos que seguramente le permitirán aumentar su ritmo cardíaco y llenar la panza de risa. Number 2, scavenger hunts. Collect items on a list. You can pick things up from nature or create your own list. Head outside, inside, or on a walk. Número 2, carreras de búsquedas del tesoro. Haz tu propia lista y explora todo. Number 3, indoor games. Número 3, juegos en casa. Try games inside like charades, Simon Says, and hide and seek. Make sure to use big motions. Prueba juguetes en casa como farsas, Simón dice, y el escondite. Asegúrate de usar grandes movimientos. Number 4, try some online classes. There are so many great free resources on the internet. See what you can find by searching for kid-friendly exercise classes and give one a try. Número 4, clases en línea. Hay muchos recursos gratuitos excelentes en la internet. Ve lo que puede encontrar buscando clases de ejercicios para niños y pruébelo. Number 5, the Exercise Circuit Challenge. Número 5, un circuito de ejercicios. Set up different stations to do different activities. 10 jumping jacks, bicep curls, whatever you would like to do, and rotate every minute. Blast some kids' music while you are moving. Don't have weights? You don't need them. Look around for household items that you can use. Try stations indoors or outdoors. Preparar diferentes estaciones para hacer ejercicios diferentes. Días saltos, otros ejercicios, lo que quieres hacer. Rotar cada minuto. Escucha música para niños mientras te mueves. ¿No tienes pesas? No importa. Busque artículos diferentes en su hogar. Pruebe diferentes estaciones en casa o en el aire libre. The most important part in all of this is to find the time, make the time, and keep the time. Your body needs it, and everyone will enjoy it. The challenge starts today. Share ideas on how and your family are committing to movement. La parte más importante de todo eso es encontrar el tiempo, hacer el tiempo y mantener el tiempo. Tu cuerpo lo necesita y todos lo disfrutarán. Tu desafío comienza hoy. Comparte ideas sobre cómo usted y su familia se están comprometiendo con el movimiento. Let's go!
Let's go!
¡Vamos!
Vamos!
Muy bien, ya tuvimos un tiempito para escuchar la opinión, un poco de diversión, aprender un poco juntos también acerca de formas de mantenernos activos, haciendo ejercicio. Y también llegaron un par de preguntas. Tengo acá una que dice, oh, I'm so sorry. I forgot that we were in English. I was back in Wednesday. Oh my gosh. Okay, we had the time to learn a little bit and learn some new ways to stay healthy and exercise. So in the meantime, we had a couple of questions that arrived, and one of them is, should I get a flu shot this year? Should my kid get one too? If so, when? I apologize again for speaking in Spanish. Totally forgot, but all right, Colleen, your turn.
Yes, so a flu shot this year is more important than ever. Everybody should try and come and get their flu shot. Of course, make an appointment to come, but get the flu shot before the end of October. That would be the best. That's the recommendation by the CDC. So children over the age of 6 months old, so 6 months and older, they can get their flu shot, and then we'll decide if they need a double shot or if they just need one. For adults, also very important. It's also, I mean, it's not just to protect yourself. The flu shot serves also to protect the community. So when you get your flu shot, it helps to reduce the likelihood of you getting sick from the flu. And then also by reducing your likelihood of getting sick, then you reduce the likelihood of getting other people sick as well. So maybe you're healthy and strong, but somebody else, your neighbor, has a weak immune system. So it's very important to protect your neighbors as well by getting vaccinated to keep from getting anybody else sick as well. So everybody come get their flu shot this year.
Perfect. Thank you. Also, I have another question. This is, I feel like I've been working at home a lot and therefore not eating very well or moving around a lot. Do you have any advice?
Well, I would say that trying to create a schedule. So I know that we are all sort of functioning in a different way right now. We're in this new way of living where we're in our house a lot more and we're probably on the computer a lot more than we would normally be. Setting a time in terms of exercise, setting a time during the day when you get up and you move around. Actually, really just like the video just showed us, setting aside time during the day where you have to get up and move around, even if it's just to walk around outside for 10 minutes, taking the dog for a walk, going out for a walk with your kids, or just, putting on a little short YouTube video for 10 minutes and doing something like that. And then in terms of eating, deciding what is okay and what's not okay. So the days that, you think that maybe you're going to be a little bit more tempted, setting goals for how much water you're going to drink and trying to make sure that you're not bored eating. that you are staying well hydrated, because a lot of times people think that they're hungry when they're actually just thirsty. And so trying to drink more water, because we're not moving around a lot. So we're probably not thinking of needing to drink water. So stay better hydrated, and try to keep the snacks locked away or out of the house altogether if you're going to be tempted.
Perfect. Thank you. We're going to move on to the next topic, which is in this case, mental health and self-care. So as we talk about this topic, I wanted to, again, share the question, give you some time to think about it. And if you feel free to, if you want to share your opinion or anything that we could improve, again, to remind you that we are here to hear you, to get your feedback, then things that we've been doing good, things that we could improve. And it will be our pleasure to put to work into a way that we can better serve you if we haven't been doing so this far. So the question that I have for you is, what are you doing at home to take care of yourself? What have you been doing at home to take care of yourself? If you don't mind sharing any things that you've been doing, this could be mental health, staying healthy, and then the question is, what can LCH provide to assist you in better managing your mental health? Those two questions there: what have you been doing at home to take care of yourself, and what can LCH provide you or assist you in better managing your mental health? So we're going to pose those questions there, give you a couple seconds. We also have a video. If you don't know, we have these services. We have the behavioral health consultant services, and sometimes that is a little confusing to grasp. So we have a little video and overview for you to understand what is a behavioral health consultant, what's the integrated in our services, so you know what are the options for you when you come to LCH, and that is a service available for you as well. So think about it. We're going to give a couple seconds, as maybe a minute or two while the video plays, and then we'll get back to discussing your opinions or questions that were posted in the meantime. Behavioral health services, integrated versus outpatient.
You are not alone. Many people experience acute or chronic stress, depression, anxiety, or other mental illnesses. At LCH, we are here to support you with both your physical and behavioral health care. What is behavioral health? Behavioral health is the ability to manage the daily challenges and stress of life, as well as the exploration of mental illness such as depression and anxiety, and how these diseases affect overall behavior. LCH offers both integrated behavioral health and outpatient therapy services. We have behavioral health professionals that can provide different levels of care depending on your needs and preferences. LCH has 3 levels: integrated behavioral health, outpatient therapy, and psychiatric medication management. What is integrated behavioral health? Behavioral health professionals work alongside your primary care providers as part of your medical team. We are available for brief, in-the-moment consultations and follow-up visits. If your primary care provider has a specific concern, he or she will ask you to stay for a few extra minutes to meet with a behavioral health consultant to better understand how stressors or behavioral health concerns might be affecting your physical health.
What does an integrated behavioral health visit look like? It's brief. It's during a medical visit, or it can be scheduled separately. Follow-up is only as needed. There is collaboration with primary care provider. There are screenings for and strategies to manage acute stressors, depression, anxiety, sleep difficulty, health management, etc. What is outpatient therapy? Licensed therapists provide treatment for a broad range of behavioral health conditions. Therapy can be short or long-term depending on your needs.
What does an outpatient therapy visit look like? These are longer appointments that are scheduled as a separate visit. They involve regular follow-up appointments and provide collaboration with a psychiatric nurse practitioner. Outpatient therapy visits will provide evaluation and treatment for depression, anxiety, bipolar disorders, PTSD, etc. What is psychiatric medication management? A psychiatric nurse practitioner provides treatment and prescriptions for medication as needed for behavioral health problems such as depression, anxiety, PTSD, learning disabilities, bipolar disorder, etc. LCH provides psychiatric medication management to children, adolescents, and adults. Because this is a specialty level of care, if you receive these services, you will also be required to have regular outpatient therapy appointments so that we can help you achieve your best results. What does a psychiatric medication management visit look like? These include the evaluation of behavioral health conditions, medication management, and collaboration with outpatient therapists.
What if I don't know what to ask for? Let any of our staff know you have a question about our behavioral health services, and we will connect you to someone who can determine the best place for you to get started. How much do a visit cost? Just like medical appointments at LCH, the cost varies depending on whether you have health insurance or provide information about your income and household size. Our member relationship specialist can tell you what your specific cost will be for each type of visit. LCH never turns someone away based on their inability to pay.
Do I need to be an existing primary care patient? No. Anyone is welcome to register and schedule an appointment.
How soon can I be seen? Just give us a call or ask while you are at LCH for any of our other services. We will have someone available to see you in person or via telehealth the same or next day.
Call 610-444-7550 to make an appointment today.
All right, thank you. Now that we learn a little bit more about the LCH services of behavioral health consultant, again, we're hoping to hear your opinions and sharing your thoughts. We have a couple of opinions here. Well, a question, mostly. It says, I'm really stressing out about staying home and helping my kids with virtual school. Do you have any good advice for my kids and for me?
So I'd say definitely in helping with the stress, we're all trying to figure out technology and school together. But when you can, taking those breaks, if your student has a recess or a lunch break, or even when they're done school, and doing something together that you enjoy as a family. So that might be a little more relaxing, maybe going outside, going for a walk as a family, or even just sitting down and playing a game together, or reading, or having a dance party, something just to get that energy out, get that stressful energy out, and setting aside the work and school time versus the fun and play time.
Perfect, thank you. There's also an opinion that says, I really appreciate the telehealth option for behavioral health. Thanks. That's also something you should know, that you can reach out to behavioral health consultant through telehealth appointments as well, if you don't feel comfortable coming into the office as well.
Yeah, we know, especially, life is busy these days, and sometimes, especially with the kids home from school, it's hard to find a babysitter or get out to come to an appointment. So as behavioral health, we can certainly schedule that time for you, and do video telehealth calls, with whatever might be the best way to reach you.
Perfect. And so to be ending this, we're gonna do the raffle. We're gonna be reaching out to the winner later on today. And we have a couple of healthy tips that we wanted to share to end this meeting. The first one is gonna be shared by Colleen, our pediatric nurse.
Hey, so I have a tip that is for children in particular, due to being on in virtual school, but also applies to adults as well. Spending less than 3 hours on your phone per day. That is the goal. It's important to disconnect. We are on our computers, adults who are working remotely from home, or also children who are doing school virtually, are on their devices all day doing doing work, and it's bad for our eyes to be in front of a screen for that period of time. If you're then adding that time on your phone onto that, it's going to make it more difficult to sleep at night. It's going to be damaging for your eyes. So I encourage everybody to get off their phone less than 3 hours a day, get outside, pick up a book, do anything, cook, prepare meals for the week, something that's going to get you away from the screen so that you can be a little more active and in the moment in your day.
Great, thank you. And then the second tip is going to be shared by our behavioral health consultant, Meredith.
So I agree with Colleen first on getting outside. That's huge right now. Just getting yourself in a different environment, getting outside, going for walks, riding a bike, whatever. The weather is beautiful right now. The leaves are starting to change. So just kind of enjoying the nature around you. And also letting yourself know that it's okay if you're feeling stressed right now, but taking that extra time for you. And especially being patient with ourselves and with others. We might need a little extra patience these days, and that's certainly okay. But so just taking an extra 5-10 minutes each day to get outside, just relax in bed before you fall asleep without the TV on, without looking at your phone, and just spending a little extra time on you each day.
Perfect. Margarita, do you have any last words to share with the community?
Absolutely. So remember that take things one day at a time. So remember that you are not alone, that our care team has tons of resources for our community, and we are here to support you in any sense. Anything that you need, we have the sources for you. So keep in mind, you are not alone. We are here. And yes, one thing at a time.
Well, thank you all so much for your time, for our panelists and whoever was watching us on Facebook Live as well. And we will be reaching out later on for whenever we have another one of these congresses, because we do them constantly. So we like to hear your feedback, and that's the way that we can improve our services, by hearing you, our patients and members of LCH as well. So with that said, have a great rest of your day. Enjoy your weekend, and we'll see you next time.